Here in the United States, African Americans make up 13% of the population, but they're dying from COVID-19 at a higher rate than any other group. It's proving to be especially deadly in the Carolinas. In North Carolina, a third of those dying from the disease are Black. That number jumps to nearly 60% in South Carolina. CGTN's Sean Caleb spoke with people there about the factors contributing to this deadly trend.
Piece of Soul, a restaurant in Columbia, South Carolina, likes to say it promotes all that is good in the region through diversity and being locally owned. Chef and owner Philomene Jeter serves what she proudly calls vegan soul food, and her kitchen is her sanctuary.
If we're honest, actual soul food is what we serve, food that feeds your spirit, doesn't weigh you down.
The pandemic has closed the dining room in Piece of Soul, but takeout customers keep coming.
Appreciate you. Thank you. Be safe out there.
She is coping with about a 50% loss in business since the state mandated self-shelter.
I'm also going to do the Mandarin chicken.
But much of what is bad about a pandemic is out of her hands, like the disproportionate levels in which African Americans are being hurt by COVID-19.
I would not say I'm surprised. The levels of stress just from everyday life, kind of predispose you to certain illnesses. The diet that we have been consuming out of necessity or tradition is not conducive to good health.
Across the United States, Blacks are contracting the disease at a much higher rate, and in some places, such as the Carolinas, dying at a shockingly higher level.
None of this is new. I just think it's just brought to the forefront right now.
These days, Dora Jones is volunteering at a food bank in Morehead City, North Carolina. She is also the director of the Senior Volunteer Program through Coastal Community Action. Many African Americans are considered essential workers right now. A study by the Brookings Institution shows that 1 in 5 food service employees, cashiers, and stock workers are Black.
You have people out there that have to go to work. They have to maintain a normality for us, and they're putting their lives on the front line each and every day.
So if they contract COVID-19,
$27.50 with the tax.
Because they are at greater risk by interacting with people?
Yes, they're working people, but do they make enough to cover themselves insurance? And does that particular job provide them insurance?
I think if we're honest, disproportionately, we are always the community that's most affected.
Call in a little bit.
It is tough to swallow, and even tougher as they point out the full force of COVID-19 really hasn't hit low-income rural areas yet. Sean Caleb, CGTN, Columbia, South Carolina.